And then don't let there be silence. And don't force them to talk through it, and don't ignore things. The other thing is if they have questions, if it's difficult, like if they ask a question in the middle of class, yes, Johnny, how can I help you? Why does my daddy only have one leg? That might be a really difficult question to answer in the middle of math class. So you're not going to answer that in math class. You're going to say, wow, it really sounds like your dad's been through some stuff. How about we talk about that later? Or how about you bring that up with Miss Susie, your counselor? So it's okay to redirect so that it's appropriate, because that is a coping skill that kids need to learn. It is an appropriate life function that you need to learn. And kids, those are things that kids learn, knowing when to ask a question and when to get answers. Those are all learning things that we learn as we go through life. And so reinforcing that just because a child has brought something up that is concerning, as long as they are not in harm's way. Even if what they say, we know if they leave this school, they're going to be in harm's way, you don't necessarily have to handle that right then in the middle of class. So I've had that happen before, especially when I was the school counselor. The teacher would stop the class, disrupt everything, and be like, oh my gosh, Johnny just said he got hit in the face. I'm like right now he got hit in the face? No, at home this morning. Oh, okay, I'm coming. We'll take care of it. I'll pull him out of recess. So it's okay to redirect if needed, and then work on the safety or work on listening to the kids. But don't ignore them. Let them know that is a very important question, or that's a very important topic. We will get back together as soon as we're done with math class, right? So give them an expectation to know when you're going to come back to them, and make sure you come back. That's important. Some things that I need you to do is to learn about PTSD. So if this conversation is the first time that you've talked about post-traumatic stress disorder in regards to kids and the kids' perspective, then I would encourage that you do some more reading, or you look at some things. One of the books I really enjoy, and yeah, you can get it on audio, and I think he narrates it himself, is The Body Keeps the Score. The Body Keeps the Score. It's a wonderful book. It has a lot of information about adults and children and how PTSD is in the body and how we experience it and what it is. It also talks a bit about some historical toxic stress. It's a really great book. There's also some really good books out there that are more children books. So really, if you just Google PTSD in kids, either in Google or on Amazon, there are some really great books out there now about how to talk to kids about some of this stuff, how to read a story to them about it. But one of my favorites is actually a book that is not in print very much, so you might find it in your library, but it's a Dr. Seuss book called My Many Colored Days. Does anyone know that book? My Many Colored Days. I don't know why. They stopped printing it in the 80s, and then they did a special run print in the late 90s, and then they stopped printing it again. But you can probably definitely find it at your library. It's wonderful. It has colors attached to feelings with some animals mixed in there, and it's just a really good basis. I have someone over there shaking their head. You use it? Yeah. It's a really great book, really for anything, but I love it so much for a child who may be experiencing post-traumatic stress disorder or toxic stress in their family, because what they do is they will just inherently assign the colors or the moods or the feelings in My Many Colored Days to someone in their family. And that tells you so much about what's going on. And my favorite one is the elephant. I feel gray, down, low, I'm all gray. So it's got little words with it. It's really fun. In the way that it helps them learn feelings. The other thing we know about that is when you're talking to kids about PTSD is that they don't always have the words because something around them has been dysfunctional. So they haven't been taught some of those coping skills that kids learn, so they haven't been taught feeling words. And I don't know about you, but lots of kids I work with, they've been taught 2 feeling words, right? Do you know what those are? What? Mad and sad is usually what they can say. But what they'll talk to you about is that they know the feeling words of anger, and lots of times sad goes in the anger group, right? And everything else. Those are the two feelings most kids know in families that are dealing with toxic stress to any degree. And that's because anger we can see. That's why we call sad. Sometimes they even call sad anger, because we see that emotion, right? We see the things that happen with anger, and that everything else is so difficult to put a finger to. It's one reason why My Many Colored Days is such a wonderful book, because it lets the kids really think through the idea, oh, yeah, what is that feeling of joyfulness? How do I see that? What is that? And so it really helps to bring some words and images of their own making about what feelings are. Make sure I covered everything in there. And you need to not be afraid to ask for help. So many of you may be experts in your role, maybe you're new at what you do, maybe you're a one of one in your job, but it's really important if you come across something that seems to be difficult for one person to handle, or you need some help, or it's something that you don't know the answers to, please reach out to your colleagues. Working with kids who are experiencing toxic stress or have had traumatic things happen to them, there can be some weird balls that come your way. So it's really important to keep yourself connected to each other and to ask for help and to connect. And to tell the kids that too, maybe, that you don't know everything. You know what? That's a really scary thing you just went through. I'm not really sure how we make sure you're safe. I need to go get some help. So that's something you just went through is a safety issue, and it's my job to get help for you and for me. So we're going to go make some phone calls. So it's okay to reach out. It's also okay not to know everything. So when someone you love has PTSD, there's so many things that we look at, that we see in like this picture idea. That's why I like this little graphic here, because it's like I'm looking at this picture that's going on, and it's always kind of changing. So this is from someone who blogs quite a bit about their PTSD. I just got this off of Google, and it had some information next to it. But what they talk about here is how I'm triggered. This is what's going on with me, right? So I feel crazy, I sweat, I'm hot, my feet and hands are cold, I can't think, I feel like my throat tightens, my mouth is dry, I usually freeze, or the other side of that is I run away. I get tunnel vision, I can't speak, I'm afraid, like really, really afraid. My brain shuts down, sometimes I dissociate immediately. It's the most exhausting and terrible thing. Even when the immediate stress response is over, it's impossible to just go back to normal. Yeah.
This is where it takes about 20 minutes for the levels of cortisol in your body to return to whatever is normal for you. I mean, obviously, if you have PTSD, it's going to be much higher.
Right.
I mean, but in any situation, so you're in an interaction with a parent or a child or whatever, it's very stressful. And just to be aware that it really does take everybody.
Right. So she's talking about the fact that it can take a period of time, 20 minutes is probably a good average number, from a trigger point to level back out again. And so I want you to think about that. Everyone has had a moment where something sudden, terrifying has happened to you. It might be when that person cut you off in traffic. It might be when your little one tried to run out in the street before they looked. It might be driving on ice, right? That like sudden thing that happens. And think about like that adrenaline and the feelings that come through your body. It's uncontrollable, right? Everyone know what I'm talking about? Uncontrollable. It's important. It's supposed to be there. Like you are supposed to react quickly without thinking about other things to save your child from running in the road because they're not, because they didn't stop when they were supposed to. You're supposed to grip the steering wheel harder and have tunnel vision to know that you can stop or swerve around the car in front of you that just like cut you off, right? Like that's what's supposed to happen. But imagine that's happening as you walk into your son's school, or as you try and take them to soccer practice, or when you get home and the kids are so excited to see you that they're running at you into the hallway where you've just opened the door and the sun is shining in, so you can't really see them, but you just hear screeching. How's your evening going to go? Not very well, right? So that's what's happening with the parents or caregivers with kids. If they are experiencing uncontrolled post-traumatic stress disorder with triggers, this is what's happening to them. Lots of people talk about the fact this happens multiple times a day, right? All the time. And then in fact, right, my beginning of the talk, insomnia, nightmares, it's happening in the middle of the night too. This is what's happening when they're dreaming. So parenting that, or being a child in that with a parent who's struggling with those symptoms, very, very difficult environment. The other thing is being able to self-regulate back. So one of the things that came up during the break was this question about self-soothing and self-regulating. If we've got this going on by a parent, they're not self-regulating themselves. Self-regulation and self-soothing is taught to children. That's not a skill we're born with. We are maybe a little, but in regards to our lives now, we have to develop that self-soothing tool so that we are able to function in our world. And so you have to teach that as an adult. So if you're not able to self-regulate, which means calm yourself down in the moment, be able to respond quickly, you open the door, the kids are running at you, you have to be able to tell yourself in your head, nope, those are my children, they're just screeching, they're happy to see me, okay, I'm gonna hug them, right? All of that has to happen within seconds. That's called self-regulation. That means my adrenaline's not going up, my cortisol's not going crazy, I'm not feeling like I need to grab for my weapon, I can actually respond to this situation as a loving parent like I want to. All of that happens in an instant. That is taught to children. But it's taught by watching your loved ones, your parents, your teachers, other kids around you. Most of the time it's taught to kids before they're even 3 years old. And so if we're not teaching kids to self-regulate because I can't do it myself, this is where we start to see kids in school with a lot of behavior problems, not being able to handle sudden things. So this is one of those things that I think gets diagnosed sometimes as maybe ADHD or ODD, when really the kid is just all over the place trying to calm down, trying to soothe, trying to self-regulate. So one of the questions was, how do I do that? How do I help a child self-regulate? And it's really important to figure out what it is they like. So, and that lots of times it's helpful if it's tactile. So if I'm learning this as an older child, it's real helpful if it's a thing I can touch. Sometimes it can be helpful if it's something I smell. Is anyone here into oils or those kinds of things? So smell is actually one of our most powerful senses. So if you've got a kid who will do the smell might work. You got to kind of be careful with that, just depending on what environment you're in. But a stuffed animal or a soft blanket or even a rock, something that can go in a pocket maybe. It might even be something that they can kind of move through their fingers. So something that they can touch and interact with will help calm them down. So if you have, this is true for adults. I have this conversation with adults also. Many, many adults actually didn't learn how to self-soothe either. And actually lots of adults who go into the military didn't learn how to self-soothe on their own, and they like the military because the military is structured and people are telling you what to do all the time. So I don't need to know how to self-regulate because someone else is going to tell me how to do that, right? So I actually teach this to adults too. And so what you want to find out is, what do kids like how do they currently soothe themselves? So if you have a kid that's hitting things, jumping, breaking things, being forceful in their soothing, then I would encourage that their self-soothing technique needs to be forceful. Push-ups, jumping on a trampoline, sit-ups, planks, all of those things are force without hurting yourself or someone else. So encourage that. You can encourage that in your parents too if you notice it. The other way that we see a lot of self-soothing is actually internal. It's that quiet girl, it's usually girls, quiet girl kind of sitting in the corner, but Susie hasn't talked to anyone in days and she won't do her homework, but she's not really being a behavior problem, so we're just kind of not really dealing with it. She's probably not self-soothing either. So in that case, you want to look at, that's why those little doodle books are really cool. So doodling can be helpful, or maybe for that person, it might be a blanket or a stuffed animal or something they can kind of touch. Another thing about force that might be helpful if they like to hit things or whatever is putty. You know that stretchable little egg thing, what's it called? It's got a name. Silly putty. I was close. That has force, right? Because if you pull it, it's pulling back on you. What I mean by force is something that pushes back to you. So putty does that as well. Might be a little difficult in a classroom, but it's probably better than a trampoline. Another thing that I know they do as well that can be helpful in a classroom, has anyone worked with an OT with those round seats with the little thingies on them? You sit on your butt and it's got little, what's it called? What are they called?
Well, it's like
Little nodules or something.
yeah, but yeah.
Yeah, so they have harder ones or softer ones. That can be considered a force back coping skill. The other thing they can do that's a little bit less intense is put like a rubber band around the bottom of the chair, where kids' feet are, right? And so then they can touch the rubber band and move it back and forth with their foot instead of tapping their pencil. Who hates that? Oh my gosh, right? So, but maybe the moving of the feet is better. So some self-soothing techniques are really, really helpful for self-regulation. One of the keys is if you're helping an older child do that, you have to repeatedly redirect them to the self-regulation activity, like more than you think, like repeatedly. So when you set that up in a children's classroom or at home or someplace, you need to remind the adult who's going to be doing that you're going to have to repeatedly show this in this activity for months. Like they're going to do the tapping of the pencil and you need to go, no, your feet, remember your feet? Oh my gosh, I keep doing that. So you have to just repeatedly bring them back to the self-soothing thing. It can sometimes take years for an older child to get self-soothing or self-regulation onboarded as something they will just go do on their own. So what's really better is if we can teach them that as children, as little itty-bitty children, 0, 1, 2, 3. So if any of you all have friends or family members that are having babies, I would encourage that you get them something that is tactile, so that they can see if that's going to be their self-soothing tool. As it gives, and if you give them all different things, so sometimes kids, so like my niece, she is 10, and she has this little scrunchy, like, I think it is actually a dog toy. It has the hard plastic on it, and on the inside it's got like the stuff that makes like the paper sound. She's had that thing since she was a baby, and she has some concerns in school, so she puts it in her backpack. She's in a new school this year. Her family is military, and they just transitioned out, and the new school said she couldn't bring it. So I called the school and was like, yeah, that's not happening. She's going to bring it to school. And if she needs to take it out of her backpack, she's going to take it out of her backpack. And she has an IEP, so you can't tell her she can't do that. Now, can she throw it across the room? No, she cannot throw it across the room. Can she hit other kids with it? No. I mean, like, she has to handle it appropriately, right? But if she needs, and she doesn't have it at her seat, actually. She's graduated to the fact that it doesn't need to be in her pocket because it is a little big. That she knows if it's in her backpack, that's enough for her because she can go get it. And so they, like, back down, and as far as I know, it's in her backpack. So I think we're good with that. So that one slide would just kind of cued me to talk about combat PTSD, but we've talked about that a little bit, is that especially here in San Antonio, our military has been deploying for years now, and the war has been difficult. There's been a lot of combat. So just know that if you're working with families or kids that are attached to the military, or maybe it's an uncle that was attached to the military, it doesn't necessarily need to be in your recent family. It's probably a pretty good idea that if someone has deployed, they have seen some things that have been really difficult and not at all part of their current world. And that's one of the biggest things, is that they're trained to do a mission that has nothing to do with how we live our lives here in the United States. And it's a very difficult paradigm shift, transition shift. You may even work with coworkers. Maybe some of you are veterans, and so you may work with folks who've dealt with that type of environment. I would just really encourage that you remember that may be happening here, and we really look at just being kind and connected with people, and maybe use some of these techniques with them.